morning. Well, I'm honored to be able to help kick off the plenary session of our 5th annual Rudd Adoption Research Program Conference and panel presentation titled Contact Between Adoptive and Birth Families, Diverse Experiences, Multiple Perspectives. The purpose of this opening session is to set the stage for the discussions we'll be having over the next 2 days about contact between adoptive and birth families. The talks we'll be hearing illustrate the diverse experiences that constitute contact across 3 major types of adoption: domestic infant adoptions, adoptions from foster care, and international adoptions. Within each type of adoption, we'll also be considering the differing points of view of adopted persons, adoptive parents, and birth families. Our opening session features 3 speakers who have extensive research and/or practice experience working with issues involving contact. Hal Grotevant will speak about domestic infant adoptions, Beth Neal will speak about adoptions from foster care, and Amanda Baden will speak about international adoptions. To get things started, I'll introduce the first speaker, and then subsequent speakers will be introduced just before their individual presentation. Each will speak for about 20 or 25 minutes, and afterwards there will be an open question and answer time, during which questions may be directed to any or all of the presenters, and we do encourage you to use the microphones to ask your questions. So with that, it is my pleasure to introduce and speak a few good words about my mentor and colleague in the Rudd Adoption Research Program, Dr. Hal Grotevant. Hal is the Rudd Family Foundation Chair in Psychology here at UMass, where Hal works to connect adoption research with policy and practice through fantastic conferences like this one, workshops, graduate and postdoctoral training, and teaching courses to graduate and undergraduate students. Hal's research focuses on relationships in adoptive families and also on identity development in adolescents and young adults. He directs the Minnesota-Texas Adoption Research Project, which examines outcomes for adopted children whose families vary in terms of contact with their birth relatives. This longitudinal study began with Dr. Ruth McRoy, who's also here, in the mid-1980s and has followed the children into young adulthood. And wave 4, now that the adoptees are in their 30s, is currently ongoing. Hal's work has resulted in over 100 articles being published in professional journals, as well as several books. Hal is a fellow or board member of many prestigious associations and organizations related to psychological research, as well as to adoption, such as the American Psychological Association, the National Council on Family Relations, the Donaldson Adoption Institute, and the North American Council on Adoptable Children. Hal has won numerous awards for his outstanding research, teaching, and service. Most recently, this past year, Hal was honored as the Outstanding Scholar in Adoption by the Adoption Initiative of St. John's and Montclair State Universities. Today, we're fortunate to hear Hal speak to us about openness in adoption among families who have completed domestic private infant adoptions. So please join me in giving a warm welcome to Dr. Hal Grotevant.
Great. It worked. Thank you, Rachel. It's wonderful to be here and to be able to talk about the work that we've been doing on contact after adoption. And the theme of my talk is really about constructing relationships in domestic infant adoptions. And I want to begin with kind of a preview of a couple key points that I'll be making this morning. First of all, in the area of domestic infant adoptions, contact, or we may also call it openness, is about building relationships among what I call intimate strangers who view contact to be in the best interest of the child. And a key point is that the main adults who are involved in this must be both able and willing to play their parts in order to make this work. Strong positive relationships between adoptive and birth families can be very rewarding for all concerned and can support the healthy development of children. And we know this from years' worth of research and from years' worth of practice experience. And the focus of this presentation that I'm making right now will be on relationship dynamics, especially between adoptive and birth parents. But other sessions during this conference and some of the posters will focus on outcomes for children, which of course is another important topic. So just by way of a little bit of introduction about domestic infant adoptions in the U.S., there are approximately 14,000 per year, and this constitutes less than 20% of the adoptions in the United States. Most of the adoptions in the U.S. are of children from the foster care system. But there's still a relatively stable and persistent number of placements of infants that are being made. Typical reasons for placement include birth parents feeling unable to raise a child at that particular time in their life due to lack of economic resources or social support or future prospects, wanting a better future for their child, especially being in a two-parent family, and or not wanting to terminate the pregnancy. And the most common reason for adopting infants is infertility of the adoptive parents. The process that takes place, just a typical sketch of this, is that people work either through a private agency or through an independent placement in states where that's allowed through attorneys. Usually what happens is that the expectant mother reviews profiles of prospective adopters, and these profiles may take the form of videos or blogs or other forms of dossiers that they review, that they submit for review. This process may then lead to meetings and or interviews between the birth and prospective adoptive parents, and it may lead to the formulation of a contact agreement, which may be either informal or it may be written, and in some states, written agreements may be legally enforceable, and there will be a session later on today about issues of written contact agreements. Following the birth of the child, the birth parents' rights are terminated and transferred to the adoptive parents, who then have the full parenting rights for the child. And at that point, the arrangements for contact are left in the hands of the adoptive and the birth parents to negotiate and navigate. Now, initially, there were a number of concerns. This is back in the 1970s when some of these practices were beginning to occur. A number of concerns were raised at that time. First of all, on behalf of children, there were questions raised about whether this would be confusing to them, whether they really wouldn't understand who their parents were, and that this might lead to problems with identity or self-esteem, and potentially even problems with mental health or adjustment. There were also concerns raised about adoptive parents, that they might feel that they were being intruded upon, that they were really not able to establish boundaries around their family, that they felt that they didn't have control over what was happening, and that they didn't feel entitled to be kind of the full parent of their child. Concerns were also raised about birth parents, that they might experience continual unresolved grief and feel unable to kind of get on with their lives. So a lot of concerns were raised initially. But there's been a lot of research that's been done, and some of the research that was started soon after that time was the work that Ruth McCroy and I and our large team have been working on, and we call this the Minnesota-Texas Adoption Research Project, named after the states in which we were at during our second wave on this project. I'm not going to be talking about a lot of details from this project this morning, but we do have a symposium about it tomorrow afternoon. We have learned a lot about contact, and one thing we've learned is about the logistics and what actually happens. So one thing we know is that contact can occur in many ways. It can occur through meetings, through phone calls, exchanges of pictures, gifts, letters, emails, Skype communication, instant messaging, Facebook, a lot of different mediums, a lot of different ways that contact can occur. Contact can involve different people. It may involve one birth family member. It may involve just the birth mother, or it may involve many birth family members. It may involve some or many adoptive family members, and at different points in time it may or may not involve the child. Contact can also range in frequency from being relatively rare, every other year for example, to very frequent, like a couple of times a month. The other thing we know from our work is that these change over time. These things are not static. So the issue of contact is a very dynamic one in the family system. And so we can't think of it as being something that just happens once and then it's set. So I want to conceptualize this a little bit by presenting an idea of the adoptive kinship network with the adopted person at the center of this. And we think, of course, about the adopted person, the child, or the adopted person growing up as being connected with their adoptive family, and here I say extended adoptive family because that includes grandparents, aunts, uncles, and so on. But they're also connected with their extended birth family, their birth parents, other birth relatives. And all of this exists within a context that I'll discuss in just a moment. Now, the adoptive family members bring with them their own developmental histories. So they bring with them their own attachment histories, their own relationship histories. And, they come to this bringing many things to this situation. They also have certain expectations about relationships. What are relationships like? How do I navigate new relationships? They also have expectations about adoption and what they think adoption is or should be. And they also bring certain relationship skills, interpersonal communication, empathy, sensitivity, and so on. And in a similar way, the members of the birth family bring their developmental histories, their expectations of relationships and adoption, and their relationship skills. So you can see it's a very complex network here of individuals who are coming together to create this adoptive kinship network. The context is also quite complex and dynamic because in that we have the placing agency who may have had a major influence about the way in which this placement was conducted, traditions, laws, and policies that differ by state and locality, social attitudes about adoption. I mean, we've seen in the last 30 years, just during the time that we've been doing our research, that openness or contact was initially considered experimental, dangerous, and not to be done, and now it's actually quite widely accepted and people are figuring out best ways to work it. And all of this is within a cultural frame. Now, in the case of no contact, we still have the adopted person at the center of this network with their extended adoptive family, but I put the extended birth family in dotted lines because even though they may not be physically present, they are psychologically present to the child and to the adoptive family. The adoptive family members still bring all of the things that they brought otherwise, their histories, their expectations, their skills, but the birth family members, because they're not physically engaged in this, are psychologically present but not physically present, and their presence is kind of static. It doesn't change over time because they're not involved. In the case of contact, what we see is that the influences and the issues brought both by the adoptive and birth family members are dynamic and changing over time, and so that sets the stage for how to think about contact. So the question I raise here is, how do adoptive kinship networks regulate emotional distance in order to create and maintain a situation that works? So I begin with the idea of a comfort zone of interaction. This is what we all have when we enter into any new relationship. Some of us enter very quickly into new relationships. Other people are a little more standoffish. It takes a little bit longer. We all have kind of a range of tolerance for separation and connection, a comfort zone that we begin with. But when forming this new kinship network, the differences in comfort zones among all the players involved, whom I've just mentioned, have to come together in a dynamic process that involves this navigation and negotiation of connection and separation over time. What we know is that adoption often pulls adults out of their comfort zones because we're in new situations with new people under new circumstances. In the ideal situation, there's a mutually agreeable fit that can be negotiated between all the parties. In reality, it's like all families. You know, in just our regular families, we have some relationships that are closer, some that are more distant, some that are easier to navigate, some that are more difficult to navigate, and that's the way it is in adoptive families as well. A couple of examples of quotes from adoptive mothers who've been in our study, just to give you a sense of starting points about how they think about contact. The first one is from an adoptive mother who has no contact in her child's adoption. And she says, "I feel like my job is to protect my daughter and to do what's best for her and give her the most stable, normal life there is. It's kind of like my goal that she would never feel any different or think of herself any differently than Joey, their older biological son," not his real name. "I think this just gives such a level of normalcy and of stability and of unity and cohesiveness that I'm very quick to defend and protective over." So that's kind of one mindset coming into this situation. Another adoptive mother said, and this is a mom who has frequent contact with her child's birth relatives, "To me, I think that when you're going into the adoption, you have to be willing to accept the fact that the biological parents are in the picture, and if they're not in the picture, you wouldn't have a child. That's just the bottom line. And to recognize that and to recognize that they have rights too is to know that their child is alive and well and healthy and being taken care of." So yet another different kind of perspective coming into this situation. So over time then, there are a number of issues that need to be navigated. One is potential disparities between birth and adoptive parents in age, in education, and in economic resources that may reduce mutual understanding. So we know that adoptive parents in general, on average, are a little bit older than the child's birth parents. They often have more education. They often have better economic circumstances, and often those are the reasons that the child is being placed with that adoptive family. Mental and physical health, the ability and the willingness of the key adults to be able to make and keep commitments. So remember, I said that in order for these relationships to work, it's based on establishing relationships that are bought into and agreed upon by all of the key persons involved. Another question that often arises is, can there be two mothers? Or what does it mean that there might be two mothers or two mother figures, a birth mother and an adoptive mother? We know from our research that children are not confused about who their mother is, but we also know that birth mothers often take on a distinctive role, and those roles are framed in many different ways, depending on the family and depending on how they think and talk through these kinds of things. Sometimes it's more of as a friend, sometimes it's more as a more distant kind of relative, like an aunt or something like that. Sometimes there's just what they call the birth mother role, which is just kind of a distinctive role of being a birth mother. But part of this involves that navigation or negotiation between the adoptive and birth families about what their respective roles are. There may be a feeling of loss of control, partly just because there are more people involved in this relationship, and they all have a stake in how things are going. And if the kind of close family, the near-in family, is not complicated enough, there may be extended family members, out there beyond the nuclear family, who have their own views and perspectives and roles about what should be happening. So there are a lot of issues to be thinking about in terms of how this works. The emotional distance regulation process that I talked about really begins prior to placement because of the developmental histories, the expectations, and the skills that people bring. But these can be influenced and shaped by the preparation process that is involved with agencies. So here is a place where adoption agencies who are preparing both adoptive and birth parents for contact have an extremely important role in terms of helping people think about how to make the transition from where they might have been to where they will be going. Then there are typical changes that occur over the life course. So one thing we've learned in our work is that adoptive and birth parents often have contrasting needs for contact at the beginning of the adoption, and that these diverge over time. So for example, if you put yourself in the position of a birth mother who's placing her child for adoption, What is she concerned about? She wants to know that she made the right decision. She wants to know that her child is safe. She wants to know that things are going to go okay. So she wants some reassurance, and probably having some contact at that point may be really helpful and reassuring for her. But then put yourself in the position of the adoptive parents. What do they want? Many adoptive parents have been dealing with infertility for a number of years. They have been waiting. They've been on waiting lists for child. They finally get their child. What they want is to establish their family. They have their child. They want to establish their family. And contact may not be the highest priority for them at that initial time. So that's kind of maybe where they begin. But then over time, the birth parent or birth parents may begin to feel more comfortable. Okay, I made the right decision, things are going okay, I can relax a little bit. Maybe they get involved with new relationships, maybe they get married, have other children, so maybe they don't need quite as much contact. But at the same time, the adoptive parents then may be much more comfortable with they are, much more comfortable in reaching out to their birth family, and they may also be getting a lot of questions from their child that is beginning to drive an interest in contact. So what starts out in one position may actually cross paths over time. So being aware of that is another important consideration. And of course, as the child gets older, they have an increasing role in all of this because they're asking questions, they're, pressing for information, and so on. We also know that birth mothers, even when they haven't been actively involved or heavily involved over time, they have what we call a watchful anticipation of their child's 18th birthday, because they know when their child was born, of course, and they know that when the child is 18, then often they have more of an independent say in whether they will have contact or make some kind of connection. So there is that kind of 18th birthday that's in the mind of birth parents. But we also know from talking to our adoptive families and their kids that when they're teenagers, teenage things take over. Teenagers are playing soccer, they're doing things at school, they're involved in all kinds of things, and adoption may not be the highest priority on their radar at that time. In addition to just those normative things about developmental histories, we also know that life happens. Things happen that we don't expect. So new people enter and exit the family, children are born and adopted, adoptive parents sometimes get divorced or sometimes one of them dies, birth mothers get married, they have other children, and people move across the country. So a lot of these family kinds of changes and unexpected changes also affect the nature of contact. And sometimes there's what we call missteps in the dance, when things happen that are maybe not kind of moving everything forward in a harmonious way, but I like to think of these as opportunities for growth. So one is the idea of a paradoxical relationship. When you think about it, the connection between adoptive and birth relatives is incredibly an intimate one. Remember I mentioned earlier the idea of intimate strangers. It's a very intimate one because they have this close connection that's based on the child, but they're also strangers because their main connection is through the child. So figuring out how to navigate this paradoxical relationship is part of all of it. Occasionally, boundary violations can occur, and we see this both in adoptive and birth families when sometimes people have, there's certain expectations about things happening in a certain way or at a certain time when people may violate those. And of course, one of the biggest kind of violations we're seeing now is through the use of social media, through people finding each other on Facebook unexpectedly and so on. And we have a couple of presentations today talking about that. And then the idea of inappropriate familiarity. We had one family in which the birth mother and the adoptive mother were talking, and the birth mother was very, just expressing her pleasure and gratitude about the relationship they had, and she said, I just wish you could adopt me too. And I think at that point the adoptive mother was like, whoa, this was not exactly what we were thinking of. So, but it's navigating these human interactions that adds the spice to what these relationships are like, but as I said, present opportunities for growth. So in conclusion, just a couple of comments about navigating contact and what makes it work. And I'm beginning with a quote from an adoptive mother. reflecting back on her relationship, and she said, "We used to write daily and call each other weekly, in the beginning. When the children were real little, it was tremendous intensity. And I think as our birth mother became more secure in herself and went on to finish college, her need to have to see them once a week or once a month became less and less. And she feels more comfortable with us, we feel more comfortable with her, and we just know that we always have access. You just take it one day at a time. If you want it to work, you'll work at it. We feel it's healthy and we want it to work because of our children." So I think just in this one succinct quote, you see illustrated many of the concepts that I've been talking about. So among the things that I think are key components then, a shift in thinking from a nuclear family to embracing this idea of the adoptive kinship network. Valuing the child's dual connection to birth and adoptive parents. Engaged participation from both birth and adoptive sides of the network. Flexibility in day-to-day logistics, just helping making things work. Excellent communication skills and commitment to the relationship in the best interest of the child. So when those things come together, then contact can work well, in this case of domestic infant adoptions. And what we're going to see now as we move on to our next presentation are additional layers of complexity that occur with adoptions from foster care and from international adoptions. So thank you very much for this.